Diabetes is caused by abnormalities in basic glucose transportation and metabolism. In a normal individual, first glucose arrives in the bloodstream, followed by insulin. Some insulin, known as insulin receptors, will then attach to the cell and allow for glucose transportation. This will in turn create ATP, which is what gives the cell energy. So this is what will happen normally. However, in type 1 diabetes, the process is slightly different. After the person eats, glucose will travel down the bloodstream as it normally would, but there's absolutely no insulin present in someone with type 1 diabetes. Since there's no insulin, there's also no receptors, meaning no glucose can make it into the cell for ATP production. Instead, fat products will become present in the cell to create ATP in an alternate way. This also kicks up the level of ketones in the bloodstream. So when type 1 diabetics have a blood test, they will have an elevated level of glucose, no insulin, and elevated levels of ketones. In type 2 diabetes, the process again becomes a little different. There is plenty of glucose and insulin that arrive in the bloodstream. Type 2 diabetics will actually typically have excessive insulin. But despite this, there are very few insulin receptors. In turn, only small amounts of glucose are able to make it in the cell, leaving the cell starving and needing energy. ATP can be created at small levels, but again, it is not adequate like in a normal person's body. Type 2 diabetics are characterized as having excess glucose, excess insulin, and no ketones in the blood. The image show is a representation of a glycogen molecule. Type 2 diabetics have an abnormally high production of glucose from the liver, which leads to high glucose levels in the blood. Because of recent evidence, we know this is due to the overproduction of glycogen phosphorylase. This is the enzyme that catalyzes the release of monomeric glucose from the stored glycogen polymer. This is important because oral hypoglycemic medicines, which are used to lower the blood sugar, have been ineffective for type 2 diabetics. New studies show promises of glycogen phosphorylase inhibitors as new hypoglycemic agents that will be successful in type 2 diabetics. Just a few complications that can come of diabetes include, but are not limited to, various foot complications such as sores, kidney disease, also known as neuropathy, high blood pressure, which raises your risk for heart attack, stroke, eye problems, and kidney disease, and gastroparesis.